Welcome everyone, Dr. Mandell here with you. Hopefully you are having a pleasant day or night, regardless of where you are. I want to say hello and welcome. I want to touch on something very quick, very important, particularly those people who suffer with chronic head, neck, headaches, jaw, visual problems, maybe even ear problems, equilibrium problems. Here is something that's quite interesting. I want to talk about the temporalis muscle. Let's go ahead and look here. Here is the temporalis muscle, and if you look here, it's a band of muscles that run superior to inferior. These are the strongest, most powerful muscles in the TMJ region, the temporomandibular joint. These trigger points, I'm about to show you, but they're trigger points in those areas that will refer pain to many different parts of the head, particularly the eyebrows, behind the eyes, even in the teeth, the TMJ area. The temporomandibular joint lies in the referred zone in the myofascial trigger points of even the 7 cervical vertebrae, including the upper trapezius and the sternocleidomastoid muscles, which are behind the neck and the shoulders. But it's important that we realize these muscle attachments, because by making changes, see if I can come back here, as we come back here, by making changes, we can actually do wonders for many people who are chronically having chronic headaches, chronic neck pain, eye problems, headache problems, migraine problems, cervical cranial problems underneath the skull, as well as referred pain into the facial area or the jaw. Now, I want to explain that the temporalis muscle, the main purpose of this muscle is to clench and squeeze and chew your food. In other words, if you open your mouth now, open your mouth like I am, put your hands in the side of your temporal area and bite. Now imagine you have food in the back of your molars and you're squeezing and breaking the food down. Those are your temporalis muscles. Now, very important, if you look at the temporalis muscle, you see all these different arrows going different ways. Those are different areas of pain you can experience from these muscles. It's just not here. This particular muscle is a very thick band of muscle. As we say, it's one of the strongest in the TMJ area. This attaches to the coronoid process, which is in the jaw area right here, and it brings the mandible upwards. So in other words, if I open my mouth, here's your mandible down here, here's your maxilla up here. If I open my mouth and I close, as I squeeze, these muscles up in here is doing the job. But I want to bring out some very important things regarding these muscles. Constant pain behind the eyes. These are some written research, particularly to temporalis tendinitis. When that muscle attaches into that coronoid process right about here, you can get inflammation of that muscle. This can cause intense headaches. It can cause restricted jaw movement. You may notice you may have grinding when you sleep. This can be very tender in your upper teeth or actually your jaw area. You may be sensitive to light. You can have swelling in the cheeks. You can have ear pressure or sometimes even vertigo or sometimes tinnitus, ringing in the ear as a result of this mechanism that's thrown off. So the reason why I'm bringing this out to you is that you can run to TMJ doctors, other physicians, and they'll start giving you medication, treating something that they're totally missing. And we'll do a little simple exercise that hopefully you can help this. So if you are one that many millions of people out there have a tendency to grind their teeth because of the excessive contraction of these temporalis muscles, here is something that hopefully will make a tremendous change for you, particularly those people who even chew gum that may even have increased pain. Maybe just having increased stress is a very big one. Remember, stress causes muscles to contract. So if those muscles continue to shorten, it's going to potentially lead to many of these crazy symptoms you're having that no one's ever going to figure out. You can go to the dentist and they're going to start looking for problems and you're never going to find it until you address these muscles. So what are we going to do? Let me go ahead and let's you move this down here. You can look at that temporalis muscle right there, just to give you a better idea how the fibers run. Let me go ahead and remove this right here, and we'll get a little thing here. We can just show how this little area moves around. You can get a little better picture, a little better view. You have the temporalis muscles on both sides. And what we're going to do is this. It's a little short little exercise. Now, you see how those muscles run kind of upwards to downwards. They run on a slight angle. one of the best ways that we can approach the body in any type of muscle is to cross friction massage. I'm going to take my glasses off. I don't really need to see much, but as I go ahead, I want you to go ahead and put your hands right on your head like I am on the temporalis muscles. And what we want to do is we want to go ahead and apply pressure and go posterior to anterior. This is how we're going to massage the muscle. And you're going to do this for about 30 seconds to a minute. And you can actually just start doing a little bit, Ryan. I want to show you something. As you start applying pressure back and forth in those temporal muscles, it feels real good. Now, it actually feels good when people do it for you, but it will actually feel good when you do it by yourself. So as you do this, what you're doing is you're restricting the contraction, you're reducing the contraction of the muscle. And when you get done, you start moving your jaw around, and you may even have headaches or some neck discomfort, but you do this particular exercise, that muscle exercise, just massaging that temporalis muscle, you'll see immediate changes. I challenge you, because you may be having chronic headaches. You may notice when you open your mouth up like this, you're hearing clicking in the jaw or having TMJ problems. And a little trick is just by massaging and working that temporalis, by going anterior forward and posterior backwards along both sides, that can really do wonders for you. Try it. I challenge you. So I don't care what kind of symptom you're having in the head. It may be the jaw, maybe the head, maybe headaches, maybe neck pain, maybe pain back in here, maybe restriction. Try working the temporalis muscle. You have nothing to lose. It's very safe. It's very, very effective. And I really think it can hopefully make some good changes for you. I ask you to subscribe to my channel if you haven't. I'll keep you up beat with cutting edge. Make sure your notifications go off. So hit that little thing when you subscribe to make sure you get our future videos. Check out my channel, Motivational Doc. Give me a big like out there. I'd appreciate that. On Facebook, as well as Motivational Doc here on my channel. I just want to say blessings to everyone. Hopefully this will make a change for you. I really hope it does. Leave your comments below. May God bless you and your family. We'll be with you real soon. Bye-bye now.